So I think that we are ready to start. Welcome, everybody, to the webinar Global Health Needs Global Science Towards a Coalition for the Right to Science. My name is Giulia Perrone. I am Research and Advocacy Officer at Science for Democracy and Luca Coscioni Association, which are two of the organizations that have co-organized and co-promoted this webinar, together with the African Parliamentary Forum on Population and Development, the European Parliamentary Forum for Sexual and Reproductive Rights, and the Global Parliamentary Alliance on Health and Development and Treatment Action Group. So the aim of this webinar today is to discuss the main intersection between health science and human rights, with contributions from scholars and advocates and practitioners and legislators from all over the world. Our final aim is to possibly create a coalition for the promotion of the human right to science worldwide. So before introducing the session, let me invite Neil Datta, Secretary of the European Parliamentary Forum for Sexual and Reproductive Rights, and Mike Frick, co-director of the Tuberculosis Program Treatment Action Group, to present their organization. So we can start with Neil Datta and then Mike Frick. Thank you, whenever you're ready.
Yeah. Thank you very much, Julia, and greetings from the United States, where I'm here on vacation. So it's really a pleasure for me to be with you. For me, it's in the morning. I realize for most of you, it's in the afternoon, but I'm very happy to join you for a few minutes at the opening of this session. So, dear honorable members of parliament, distinguished guests and distinguished guests from the scientific community, and ladies and gentlemen, on behalf of the European Parliamentary Forum for Sexual and Reproductive Rights and our partners, it's my pleasure to welcome you to this discussion on the need to create stronger links between health rights and science rights. The European Parliamentary Forum for Sexual and Reproductive Rights, EPF, is a network that brings together members of parliament from across Europe who are committed to protecting sexual and reproductive health and rights across the world. In Africa, EPF supports and collaborates with the African Parliamentary Forum on Population and Development to strengthen the capacities of parliamentarians to positively impact political, financing, and accountability commitments in health, gender, rights, and development. In 2019, at the Nairobi Summit on ICPD 25 years, EPF convened over 200 members of parliament and launched a new initiative called the Global Parliamentary Alliance on Health, Rights, and Development, which brings together parliamentarians from across all the continents in an effort to boost their efforts to deliver on the Sustainable Development Goals, specifically in the areas of health and human rights. As a parliamentarian network that advances sexual and reproductive rights, we wish to affirm that global health needs global science. Science is one of the most important channels of knowledge and scientific knowledge to allow us to develop new technologies, solve practical problems, and make informed choices. Today, our participation in this forum will particularly focus on the Parliamentarians Handbook on Universal Health Coverage, the UHC Handbook, that we have been developing together with other partners such as UHC 2030, the African Parliamentary Forum on Population and Development, UNFPA, AMREF, and Science for Democracy, among other partners. The right to science is one of the 10 modules that have been articulated to enthuse political responsiveness to health and health-related concepts. Thus, the UHC Parliamentarians Handbook seeks to enhance awareness and guarantee accountability across key facets of health. As a capacity strengthening tool, it enables members of parliament to focus on and reflect on what they can do to within their mandate to advance the objectives of global health. And you will be hearing more about this handbook in session 2 from my colleague Caroline Kwamboka, as well as a number of parliamentarians involved in this. So here I'd like to take this early opportunity to congratulate Science for Democracy for putting together this important meeting, and I look forward to following the robust conversations and views from scientists, legislators, state and non-state actors. Ultimately, I hope that this will serve as an excellent, that this will build upon to create an excellent community to continue working together and ensure that the rights as enshrined across human rights documents, including General Comment 25 of 2020, remains at the fore of the global discourse. So I wish you very fruitful deliberations, and back to you, Julia and Marco.
Thank you very much. Also, thank you very much for dedicating part of your free time to this webinar. It's very much appreciated. Thank you so much. So before leaving the floor to Mike, just a few technical instructions. Thanks to our interpreters, Monica Carbone, Valentina Guani, Amalia Amato, Antonella Angelini Rota, and Alessandra Giordani. This webinar will be available in English, Italian, and French. So just in order to select your favorite language, just please click on the world shape button that you can find on the horizontal bar on the screen here on Zoom. You can select your favorite language. Also, if you have any questions, please type them in the chat box, and the chair of each session or myself will forward your questions to the speakers. Thank you very much. So now we can continue. Mike Frick, Cournier, co-director of the Tuberculosis Program at Treatment Action Group.
Hi, everyone. Good morning and a warm welcome to this webinar. Good morning from where I sit in New York with the Treatment Action Group, where I co-direct the Tuberculosis Project aiming to end the global epidemic of TB, which until 2020 and the emergence of COVID-19 was the leading infectious killer globally and remains so in many countries. I wanted to open today's webinar by reflecting briefly on what we as an activist organization at Treatment Action Group, or TAG, bring to a nascent and emerging coalition working on the right to science and to the theme of global health needs global science. And I think that we as activists bring 3 decades of experience responding to global pandemics of HIV, tuberculosis, hepatitis, and now COVID-19. With science-based advocacy, and advocacy that sees science as integral to realizing fundamental human rights and as a human right in its own right. We bring an understanding that research and access to its benefits is a fundamental human right, that the knowledge and hard-won experience, that participation is central to a right to science and to the scientific process itself. And we really see the participation of communities most affected by a particular health condition or disease as key to advancing a scientific agenda that is based on equity, evidence, and the needs of populations most vulnerable and most in need of protection. And we recognize this moment as one in which these lessons are more important than ever before, in which we need to elevate the participation of communities affected by and at risk of COVID-19 to the center of this research agenda and the struggle for access to COVID-19 prevention, vaccines, as well as diagnosis and treatment, and that this fight is linked to previous fights we've had in global health seeking to end the HIV, TB, and hepatitis epidemics. We also recognize that at the end of the day, governments are the ultimate duty bearers when it comes to fulfilling human rights, including the right to enjoy the benefits of scientific progress. And as a representative from the activist community and civil society, we see it as our job to ensure accountability toward this end. I wanted to just close by restating our belief that science policy is health policy, that science policy is human rights policy, and exploring the connections between these ideas and making them more explicit, which I hope today's webinar and the work of this coalition will do, is absolutely essential for moving forward the global agenda on these issues. And I want to end by thanking the organizers of today's webinar for convening us for this very important occasion, for all of the hard work that went into setting up this meeting, for the engagement of the different sectors represented here, from civil society to parliamentarians to academics. And I look forward to today's robust discussion and conversation. Thank you, and back to you, Julia.
Thank you very much to you and to the Treatment Action Group for co-organizing this webinar. And now it's the turn of the Luca Coscioni Association on Science for Democracy. The Luca Coscioni Association was founded in 2002 by Dr. Luca Coscioni, and it's committed to the promotion of human rights, particularly in the field of health and science. And Filomena Gallo, she's secretary of the Luca Coscioni Association, will tell more about about our work. Just a few words on Science for Democracy as well. Science for Democracy is a platform which was launched in October 2018 by a few members of the Luca Cournier Association. Our aim is to promote the human right to science. That is why from its very inception, the Science for Democracy platform has followed the drafting process of the UN Committee on Economic, Social and Cultural Rights, General Comment number 25 on Science and Economic, Social and Cultural Rights. So the General Comment provides an authoritative interpretation of the so-called right to science, which is enshrined in Article 15 of the International Covenant on Economic, Social and Cultural Rights. The specific topics on which we work are wide-ranging. All of them are connected with science, from reproductive rights to end-of-life care to control narcotics or vegetal biotechnology and so forth, but the aim is always the same, which is the promotion of a dialogue between the civil society, that is scientific community and human rights defenders and decision makers. So today we have 4 sessions during this webinar to discuss these connections between science, health and human rights, and to create a link between the civil society and decision makers. The first session is the rights path to global health. It's chaired by Gisa Dang. She is health and human rights consultant at Treatment Action Group. Welcome, Gisa. Then we have the Parliamentary Handbook on Universal Health Coverage, which is chaired by Marco Perduca. He's former senator at the Italian Parliament, and he is the founder of Science for Democracy. This session will be followed by a Parliamentarians Panel chaired by Honorable Memouna Drago Sawadogo from Burkina Faso. And then we will have the last session, which is the World's Coalition for the Promotion of the Right to Science, which will be chaired again by Marco Perduca. So during the last session, there will be an interactive moment as well. You, the audience here on Zoom only, will be asked to answer a few questions. So we will share a link in the chat box, and you will be able to click on that link and to answer those questions, and it will help shaping the discussion today. So I'm happy now to leave the floor to Filomena Gallo. Neil, that again, if he wants to add a few words during the opening remarks, and Gisa Dang from the Treatment Action Group. So Filomena, you have the floor whenever you want.
Grazie Giulia, grazie per la partecipazione.
Thank you, Giulia. Thank you for your participation, to the participants and those who are following through the social media. This webinar aims at discussing issues such as health and science in their human rights implications. And it refers both to international obligations that states have for having ratified human rights treaties, and to the actions that civil society can or must take in order to correct governmental inattention and the ensuing problems. In the last 3 months, we had a Global Health Summit convened in Rome by the Italian G20 presidency, the WHO Assembly, and a G7 dedicated to the pandemic. In the final declaration of the G20, science appears or is mentioned a couple of times as a ritual formula, rather than as an essential component in the search for solutions to the pandemic. And the same goes for G7, which addressed important issues such as licensing for the production of vaccines, but it is not clear whether at the end the commitments were made to get 1 billion vaccines to the countries most in need, even though we know that this is just 1/10 of the amount of vaccines that would be needed. Certainly, no specific funds were set aside to step up efforts to sequence the virus or to research other vaccines, not to mention investments worldwide in the development of antiviral therapies or mental or treatments for mental health. That is one of the many structural problems of our time that partly because of the pandemic affect millions of people worldwide. In the past 2 years, the World Health Organization has been understandably under great pressure, but again, no measures were taken to promote some kind of spin-off primarily concerned with research. And yet, as stated, as stated by the former president of the European Medicines Agency during a recent webinar held by our association, if research were coordinated and distributed around the world, it could yield greater results in a shorter time. Of course, the centrality of science in human progress is not in question. We all agree about that. And yet we take for granted some arguments, some self-evident concepts. And when we do so, they tend to disappear from public discourse, they become topics for technicians, for experts, with whom discussion becomes difficult. So what I'm saying is that we should make the fruition of the product of science as transparent and as accessible as possible, so as to allow the construction of opinions and also the drafting of laws and policies on the basis of factual data and of scientific evidence. It is only through participation and through the sharing of knowledge of what has been studied that we will be able to take decisions that are based on common sense and that, above all, respect the human rights. This is why it is important to devote time and resources to promoting the notion that science is a human right, and to do so all together. This is also stated in the subtitle of this webinar, towards a coalition for the right to science. I won't go into the details of what this right is made up of, because there is going to be a session about it, but I'd like to emphasize that restricting scientific research for political, ethical, or religious reasons, imposing costs for access to trials or not funding trials because they may appear marginal because they refer to people that are geographically distant from us. Well, this is not simply selfish. It is a real violation of human rights. And in the medium and long term, this will have negative consequences on us too. So, this is one of the elements that we should communicate. I'll give you an example now. Global health needs a global science. Global health needs science that is inclusive both in the trials and also in the geographical areas where the trials are carried out. A couple of weeks ago, The Economist devoted 2 stories to an initiative involving African DNA sequencing. The African continent is considered as a cradle of humanity, of mankind, and African genomes contain more genetic variations than those of any other continent. And despite this, only 2% of the genetic diversity in Africa was ever studied. A study published in Nature in November 2020 revealed the whole genome sequencing analysis of 426 individuals from 50 ethno-linguistic groups, including previously unsampled populations. And this means exploring the extent of genomic diversity across Africa. By doing this, scientists discovered more than 3 million previously undescribed variants, most of which were found among individuals from newly sampled ethno-linguistic groups. Among other things, the economist mentioned how some diseases such as cystic fibrosis or congenital deafness could be diagnosed earlier if and when these studies are consolidated. Out of destruction of selfishness or of prejudices that are sometimes racist prejudices. For years, we have been neglecting Africa in this field too, and we have developed not only medicines, but also diagnostic tests that were not based on data relating to the people for whom these innovations were intended. The same could be said for the algorithms underlying the vast majority of artificial intelligence or facial recognition applications that discriminate positively or negatively on the basis of skin color. I'm not going to address the issue of reproductive health or gender inclusiveness and equality in science because we know, because we've talked about this on other occasions, and because there are dozens of organizations that are fighting for the rights of women to access science and scientific data. Gender inequality is a very serious violation of human rights, and it is perhaps the most widespread and systematic in the history of mankind. And we must remember this when we promote the right of and to science. And another topic I'd like to discuss today is that of data. At a time when the balance of power at a global level is based on the intersection between biotechnology and big data, we are still missing rules to regulate biotechnology so that the data produced or retrieved by institutions and by the private sector are collected and aggregated according to scientific criteria rather than being kept hidden from the public. I'll give you an example about my country, Italy. Restrictions have been adopted on personal freedom, and restrictions on personal freedom have been imposed in Italy during the pandemic on the basis of estimates without having access to consolidated and disaggregated data. We were told about calculated risks without knowing on what numbers those calculations were based. And there are wide or global examples of this. Take, for example, the recent World Drug Report published at the end of June by the UN. It is a document compiled with information from
di un fenomeno così pervasivo come quello degli
Can a phenomenon like drugs and drug abuse be described without knowing what happens to half the world's population? Data on the Arab world, for example, is missing. The same could also be said about censuses. In many countries, the pandemic has blocked or postponed the censuses, while other statistical studies carried out with face-to-face interviews have been suspended indefinitely due to social distancing. Is it possible that, or can we accept that the technological transition is being used
anche partecipato nel pieno rispetto della privacy? I dati
way, while we have no quality data collected in transparent and open way about science, data, whether big or small, are central to planning our future and to the achievement of the sustainable development by 2030. Scientific progress has countless applications that can be created through local ideas or needs, and the platforms of the so-called sharing economy must also be accompanied by the possibility of producing apps that can aggregate open data in order to contribute to public health and well-being everywhere. Coordinated cooperation is highly necessary. The Anti-Personnel Landmines Treaty, the International Criminal Court, the abolition of the death penalty, or the fight against climate change have become the object of institutional debate at the UN, because coalitions of NGOs and people of goodwill have been insisting on it, because people have insisted so that the world leaders would do their job, that is to respect international law, that international law that their forefathers have helped adopt at the end of World War II. And we should try and do the same thing now, and I hope ours will be a very fruitful discussion.
During this webinar today. Thank you so much again. And now I can see from the chat box that Neil that I had to leave. So I'm pleased to invite Gisa Dang for her opening remarks from Treatment Action Group.
Thank you so much, Julia. I am coming to you today from middle of nowhere, Germany, and I'm so glad to see already in the chat of people exchanging where they're coming from, and we have such a very diverse crowd here. I would, of course, like to start off by expressing my gratitude to colleagues at Science for Democracy, our wonderful Parliamentary Alliance interlocutors, Caroline Kwamboka and Sonia Dimbira, and all the co-sponsors of this webinar. Of course, my gratitude to our wonderful speakers today, our interpreters, and the technical staff behind the scenes. As always, I want to thank my colleagues at Treatment Action Group for giving me this opportunity to be here with you today. Treatment Action Group, you already heard Mike Frick speak, envisions the end of the HIV, tuberculosis, and hepatitis C pandemics with the discovery, development, and worldwide dissemination of safe and effective diagnostics, preventives, and cures through public health structures that end systemic harms and promote human rights, and that are developed by the diverse communities most affected by these conditions. This vision, the Treatment Action Group believes, will be realized based on data and science and achieved through community engagement, distributive justice, and equitable access to the benefits of science. So a warm welcome to everybody today attending and to ponder this question about global science and global health. You are bringing such diverse backgrounds to this event, and your diversity and expertise is precisely why we wanted to have this webinar. It's lovely to have this broadening group of people committed to implementing the right to participate in and benefit from science and its applications. And though some of you may feel you're not too familiar with the right to science yet, let me assure you it is all around us already, especially, of course, for those of us working on health and human rights. And you're here today, which means you have likely used one or several of the right to science concepts already. Let me give you a few examples, even though you've already heard a number of fabulous examples from Ms. Filomena Gallo. If you are working on science education or science or financing research for diagnostic treatment and prevention, then you are already working on the right to science. If you are building on scientific evidence and formulating policy proposals, then you are already embracing a right to science approach. And do you think we could have researched and made available COVID-19 vaccines in a way that ensured equity and access and fair returns on public investments? You can argue these points exactly using the right to science concept of non-discriminatory accessibility, availability, and quality, as well as international cooperation and our government's obligation to develop, diffuse, and conserve tangible benefits of scientific advances. These are all examples of the right to science in action. And our aspirations as Treatment Action Group is that the right to science moves from this latent concept to an active tool that we begin to call by name to advance human welfare and health. That we all recognize the right to science as necessary for the realization of other rights and as a standalone right. And that the right to science becomes an organizing framework for movements working at the intersection of social justice and human rights. And finally, that the right to science takes its place alongside other cultural rights, such as education and social economic rights, such as health. We are here to learn today, but we're also here to introduce this idea of a coalition committed to promoting the right to science. So I want to leave you with this question to ponder throughout the webinar that we will get back to at the end of today's sessions, which is, what will the world look like in your area of expertise if this coalition were established and if this coalition were successful in its activities? So something to think about while we'll start on our panels. Thank you, Julia.
Thanks to you, and I think we can start with the first session, which is started by you. So I leave the floor to you again. And so I thank all the organizers once again. And so we can start with the first session. I kindly ask all the speakers to use their headphones and mics if they can, because it improves the quality of the audio, and also because some of the speakers have some concurring engagement. I will ask you, Gisa, to take the helm of discussion and start with Andrea Boggio and Giovanni Brauzzi, if you can. Okay, so then thank you very much again, and we can start with the first session. Thank you.
Great. Thank you, Julia. So here we are, our first session of the day. Excuse me, my computer, of course, is acting up right now. Here we are. So we are here on this first session, the rights path to global health. And I want to introduce you to 4 wonderful speakers today. We have, to start us off, Professor Andrea Boggio. He's a professor of legal studies at Bryant University. His latest book is Human Germline Genome Modification and the Right to Science. I also know that he is working on another piece on the right to science that I'm personally very excited about. We will also hear from Mr. Giovanni Brauzzi. He's a retired Italian diplomat who has worked with New Europeans on the European Health Union. He is now with the Associazione Tutta Europa 2030 and is also developing ideas for the digital platform of the Conference on the Future of Europe. Third, we'll have Mr. Ezio Taborado Santos Filho. He is holder of a PhD in health sciences as well as a lawyer. He's here today in his role as community engagement project coordinator for Rede TB, which is, as he will explain to you, the research network on TB in Brazil. He will talk to us about medical trials participation and the right to science. And lastly, we will have Ms. Jessica Wyndham, the Director of Scientific Responsibility, Human Rights and Law Program of the American Association for the Advancement of Sciences. We'll start with the first speaker now. And then after all 4 have ended, we'll have time for some discussions. Professor Boggio, if you would start us off, please.
Yeah, I'm gonna share my slides. Okay. Thank you, Gisa, for introducing me. And today I was asked to talk about the relationship between the right to science and global health. And in particular, I've been asked to talk about General Comment number 25, which is the instrument interpreting Article 15 of the International Covenant on Economic, Social, and Cultural Rights, which was adopted a little bit over a year ago in April 2020. And how this General Comment can contribute to global health governance. So if I can rephrase the assignments a little bit, I would say that the core question I'm looking at is, can a right to science-based approach contribute to strengthening global health governance? I believe that in 2021, any discussion of global public health cannot avoid confronting the ongoing pandemic. COVID-19 has claimed more than 4 million lives so far, and the number of infected individuals is getting close to 200 million. Globally, more than 1,000 people still die on a daily basis. So the ongoing pandemic is an opportunity to assess the impact of human rights law on the public health threat of the century, but also imagine how human rights can contribute to ending the pandemic and setting better standards for global health in the future. With that question in mind, I want to start by glancing briefly at the world map showing the current coverage of COVID-19 vaccinations, because I'm going to focus on this problem. What becomes immediately apparent if you look at the map is the unequal distribution of vaccines across nations. Many countries have reached the 70% threshold of population being vaccinated, and several others are getting close. But many other countries virtually have no vaccination or in the single digit. What even more dramatic is that it will take months for regions of the world in light color to become dark color regions. And I'm quoting for this January 2021 report published by the Economist Intelligence Unit. In poorer economies, I'm quoting, widespread vaccination coverage will not be achieved before 2023, if at all. End of quotes. 6 months later, this prediction is still current. Clearly, we are facing a situation of obvious deprivation of basic human rights, health, and enjoyment of the benefits of scientific progress, which is current and is going to stay for the foreseeable future. So I think there are two questions that I'm going to narrow down. First is, are the duties associated with the right to science, could they change these predictions? And would have the picture been would have the picture been different if the right to science has been taken seriously earlier in the pandemic? So I will analyze focus my analysis looking at 4 drivers of these inequities. There are more, but I'm just going to focus on 4 because of the time constraint. There is capacity, which is the capacity to develop and produce vaccines. This capacity is restricted to a handful of countries, what are called the originator countries. Not surprisingly, also these are the countries with the highest vaccination rate. The second driver is politics, which in this context goes under the name of vaccine nationalism or sovereignty. And vaccines have been available primarily in limited quantities in originator countries, those with the capacity to develop the vaccines. And these countries have prioritized distribution domestically. The third driver is innovation policy, and particularly intellectual property rights. COVID vaccines are protected as intellectual property rights of pharmaceutical companies, and originator countries have so far guaranteed and enforced these rights. Vaccine also must be registered in each country to be marketed, and where they are not registered, they cannot be sold, and generic versions cannot be produced. The fourth driver is global governance. International organizations, and in particular the UN bodies, have limited power to change the status quo and address inequities. They can issue statements, generate ideas, organize resource pools, set up local technology hubs. All the things have been done, but fundamentally they lack the ammunition to address the 3 other drivers on the slide without the consent of the countries that are part of the international system. So how does the right to science relate to these drivers? So regarding capacity, General Comment 25 states that state parties must ensure that scientific progress happens. This is a duty to support basic and applied research. And in particular, there is a core obligation that in allocating public resources, priorities must be given to research in areas where there is a greatest need for scientific progress in health. And I'm reading from the general comment. I think from this we can easily argue that that there is a duty to create capacity to develop vaccines. A second aspect of capacity is the duty of countries to ensure access to those applications of scientific progress, particularly when critical to the enjoyment of the right to health. Here again, we are looking at a core obligation. There is a positive obligation to ensure that the fruits of science are widely distributed and available to vulnerable and marginalized groups, including creating and maintaining an environment for the diffusion of scientific progress in the form of applications. Now, keeping in mind that COVID vaccines are novel and a sophisticated technology, countries have a duty to create the capacity to manufacture those vaccines as a matter of duty under the right to science. Now, the politics, here we can read Article 2 of the Covenant, and it reads, all peoples may, for their own ends, freely dispose of their natural wealth and resources, without prejudice to the any obligations arising out of international economic cooperation based on the principle of mutual benefit and international law. So domestic allocation of vaccine that is of prejudice to the obligation of benefit sharing in international cooperation violates international human rights law. Also, Article 15, Section 4 includes a commitment to international cooperation in the scientific field, and General Comment 25 reads, access to research results and their applications should be regulated in a form that allows developing countries and their citizens adequate access to these products in an affordable manner, such as access to essential medicine. Unfortunately, the COVID vaccines are not essential medicine at the moment. Now, vaccine national sovereignty, the principle that our people come first, therefore must be balanced as a matter of human rights law against the duty to share the benefits of scientific progress internationally. And I think here the right to science may have an edge over the right to health, because the covenant where it codifies the right to health in Article 12 doesn't really mention explicit international commitments, while these are explicit, as you can see earlier in the slide. Section 4, Article 15 makes it a duty under as a matter of right to science. Now, intellectual property rights is a very complex topic, and I'm reading General Comment 25. States must guarantee the social dimensions of intellectual property. A balance must be reached between intellectual property and the open access and sharing of scientific knowledge and its applications, especially those linked to the realization of other economic, social, and cultural rights, such as the rights to health, and etc. Intellectual property is a social product and has a social function. So this language imposes a duty to limit intellectual property protection or enforcement if necessary to save lives. It contains a novel principle that the use of patent is mandatory, even when the patent holder refuses to enter the market. And in other words, on the applications, once the applications are in existence, government must ensure that the diffusion of these applications as a matter of Article 15. Holding a patent and not using it should be considered an abuse of the patent and therefore unlawful. And finally, imagine you have a permit to register a vaccine in country A, let's say because it was approved by the FDA in the United States, but this has not been registered in another country, country B. When the manufacturers in country B should be able to produce the generic versions of drug and vaccine without the need to conduct further research or looking for further approvals, if that application, and particularly in vaccine, has been approved in another country going through a proper risk assessment. That will really greatly enhance the ability to spread the benefits of scientific progress. Governance mechanism, we can read Section 4 of Article 15, again underline the importance of international cooperation. International bodies must have the power and resources to anticipate and manage global health threats. These powers must be adequate to address the drivers that are causing unequal access to COVID vaccines. And there is, in the making, the idea of a pandemics treaty that could solve some of these problems. So to conclude, I want to just go back to the core question, whether or not the right to science can help global health, and in particular the current pandemic and the accessibility of applications relating to COVID-19. I try to demonstrate that the various duties that are listed here on the slide, if taken seriously, provide a robust framework to achieve these two goals. The law is there, it's a matter of taking it seriously. And to this end, I believe that the human rights advocate and the soon-to-be launched Coalition for the Right to Science should play a prominent role in pushing this agenda. Thank you very much.
Thank you, Professor Bourdieu, and you raised some very important points, and we do have some representative of the Access to Medicines movement with us today that I'm sure will be glad to jump on the bandwagon there and talk about making these laws reality, since they already exist, and can share about the work that have previously done on other diseases. I would now like to invite our second speaker, Mr. Giovanni Brazzi, to take the floor. Julia, is he there? I can't hear him.
So he should be.
Can't see him.
All right.
Yes, I can see him, but I can't see his video. So I don't know if he can hear us.
Well, as we work that out, Izia, would you be prepared to go next?
Maybe, yeah, maybe we can move on and then.
Sure. Yeah.
Sorry. So Izio Tavora, long-term activist, lawyer, PhD.
Thank you for the kind introduction, Giza, and thank you for you guys to put this together. I think this is a very important discussion. I have a few slides just to guide the discussion. I think my kind of invitation that Mike and Giza made me is to bring some of the perspective from the ground. I mean, in terms of what have we been doing so far? So so to say rationale behind what the work we do as advocates. The path to the improved health policies requires strategy to participate in research and development since the 1990s. So this actually started maybe even before in the AIDS movement as well. We have seen also some isolated experiences in different countries before with other diseases, but this was an exercise that the AIDS movement did in order to provide a response that the state was not providing in care and access to treatment to people affected back in the late 80s, early 90s. So this created the environment to the participation in research and development, the following up research and development helped creating this path to discuss the new policies and speed up the implementation of new technologies. We use broadly in the world in HIV and AIDS since the 90s with the so-called concept of the community advisory boards, or CABs, which are groups of advocates which develop their research literacy and treatment literacy in order to be contributing to the discussion and to bring the perspective and the needs. The idea is exactly to generate a demand for the development of new technologies. Please, the previous slide still, Giza. And the idea is to discuss the development of new technologies, and I call them soft and hard. The concept of soft technologies being guidelines and the framework where they will be applied in the health systems, and hard technologies are obviously the diagnostic tools, etc. So in this way, we can be implementing and incorporating this technology. Next slide, please. So the idea is to build up bottom-up strategies by community engagement by means of CABs, as I said, or ethical. Many places, community representatives are involved in ethical committees or discussion, so that they, and this participation is based on a concept that comes before, which is the human rights concept that we absorbed. I mean, that was the strategy we used back in the 1990s. I started as helping to build the first office at a person with AIDS organization back in 1990 to create advocate support, people affected support by lawyers to create access to treatment and to participate in different discussions. So the idea of the rights to science is based on the human right principles. The idea of engaging the communities by means of CABs or community or ethical committees or other forms of community participation create the path to do something which is critical, which is engaging the communities in the health policy discussion and in health policy forums. So, but this doesn't go by law. I mean, we have this in Brazil, a long practice of that, because first we had back in after the military regime, we had the Constitution of '88, which previewed the universal access and the creation of the unified health system in Brazil, the SUS, and the concept that there should be a representation of people affected in the committees that discuss the health policy. So this was applied in Brazil as an example, and we tried to build this in different contexts in terms of engaging the communities in policy discussion and health policy forums. So, and this is the previous engagement in research and development leads to be able to discuss the implementation of new technologies. And this should happen both in local, national, regional, and global levels. We have now an opportunity that we are carrying on with the WHO. I'm a member of the WHO Civil Society Task Force. And the idea is of pushing the multi-sector accountability framework with one of the main objectives, one of the main points is to push the participation of communities in following up research and development and inclusion in the policy-making forum. So I bring two different very recent examples of engaging communities in research, such as the community engagement lessons learned that we just shared. Giza has copies of that for those who are interested in the English version. And the Brazilian Civil Society report on the impact of COVID in TB, HIV policies. So this, next slide, please. The idea is to have creating conditions to people not only follow, in different places, to be following up studies and understanding what the research, what research does and what requires to research, but also understanding what is behind that. What are the forces which drives research agenda? So, and most importantly, to develop a discussion on national level. What is the research agenda? So what are the products that need to be included in that health system? And what is the best tools that people need? So this discussing is fundamental. I brought the two different examples. One is the follow-up of one multicentric study, which is a STREAM study that happens in seven countries. And the other was a civil society report, an assessment that the civil society representatives did to generate data, to generate evidence, and to offer to the government some very objective recommendations. But the point is what we find as common results of that in both experiences. One international, specifically following up one study. And something that the civil society did as monitoring the policies and the impact of COVID in TB and HIV policies is at the same time, there is a growing understanding of the importance of communities in research, but also a resistance from the government and sometimes even from the research institutions to absorb the community perspectives and monitoring and policy recommendations. To finalize, I would highlight that a common challenge for the grassroots organizations and the community initiatives is the continued funding to allow capacity building and education and is supporting the local initiatives and engaging in policy decision making. This is not easy. I mean, we have to do, as I said, in different contexts, in different countries with different political situations, and we have to take them by the hand. So this is fundamental to do. And the funding to do this is very scarce. We hardly have proper funding to do so. We see on tuberculosis, which is my focus now, a growing funding and a growing understanding, as I said, of the importance of communities in research. So some studies start including a component of community engagement in their clinical studies. And this is fundamental to change the reality. What we saw in HIV and AIDS back in the 90s was exactly that. When the donors and the sponsors were mostly pushed to include community advisory boards in clinical trials. So we tried to have that also in tuberculosis in order to generate this understanding of science by the communities and create this demand to improve policies. I think this is a kickoff so that we can further discuss. Thank you very much, and looking forward to discussing with you. Thank you.
Thank you so much, Ezio, for sharing from your long time history. I think we now have Mr. Giovanni Brazzi with us. Mic check, are we doing? Wonderful, please take it away.
Thank you very much, and sorry for the before. I lost the connection when I was about to start. I will be very brief. My interest for health issues started with the pandemic, of course. With the friends of New Europeans, we thought already in spring 2020 that it was appropriate to call for an international conference after the pandemic to take stock of the experience we have gained through this terrible period. And we identified 6 items that were somehow related to each other: health, economic, subsidiarity, education, citizenship, and external relations. Science as such is not there, but when we mean education, of course, this was an important component of it. Let's say the more tangible proposal, European Health Union, and the idea has been taken also by others, and we are very happy about that. But we think we have to take fully the opportunity offered now by the conference on the future of Europe, make it to go for real progress. And I would elaborate 4 points which are of fundamental importance for me. The first one is that any future health union should be part of the social pillar of the European Union, and as well be part of the announcement of the EU citizenship, the European citizenship, because this, as you advocate for science, this should be a right-based approach. Second element is that we are not starting from scratch. We may start from the existing treaties, because at least a couple of articles of the existing treaties, Article 168 and Article 222, have not been fully used during this crisis. So there is the room for maneuver already without, let's say, going into the tiring discussions about treaty changes. So this is important. Third element is that has been said already, the effort should be holistic. And here is very important what the notion of One Health developed by WHO, because any effort done on health matters should be synchronized with the digital and the green transitions we are into now. Fourth element is that we will be safe when everybody is safe. Therefore, the European Union should be among the leaders of the global efforts. The Rome document issued after the Health Summit, jointly organized by the Italian chair of the G20 and the European Union, provides elements which, in my view, are quite important. The other important element is that I think Europe can offer a model for health matters worldwide, which is the model of the universal health care. We are attached to it. Yesterday, just in Rome, I mean, the Pope, who is now at the hospital, the Gemelli Hospital, made a short statement from his room and said how important it is the universal health care. And he really seen it during this week in hospital. So I think the European Union has a fundamental role to play. But of course, I mean, here you are talking of a global effort. And to talk about the global effort, I would stress one point. It seems to me that in many of the comments I heard so far, there is a lot of emphasis on the, let's say, legal issue, the legal background. I think this could be right theoretically, but it will entail a very long time, because for every word you discuss, you have at least a conference to be organized. So in my view, more than talking about the right to science, what will be important is to redouble efforts on partnership and especially on capacity building. I think capacity building is the key concept to make progress in this fundamental area. And I would like to mention two cases, two good practices I discovered when I was an active Italian diplomat. The first one is an International Center for Theoretical Physics in Trieste. It is dedicated to the Nobel Prize Abdus Salam. This was established already in the 60s, early 70s by Italy, and then became somehow a UN-related body. And it's important because at that time when, I mean, there were more urgent needs to be filled, there was this scientist who said, well, we need also to address issues like theoretical physics. And from there, I think something very useful and so very productive has been started, and still is working closely with UNESCO. The second experience I would like to mention is the synchrotron light that has been established in Jordan, in the Middle East. The CESA, let's say, body, scientific body of this nature, which has been established, let's say, outside the industrialized world. And I think it will be good to take such an experience and to try to replicate it also in Africa, because I think this is important. At the beginning, it may sound a little bit too theoretical, but too scientific, but I think it has also a lot of practical repercussion also on the, let's say, on the production side. So I think it's quite important. So these are the thoughts I would like to share with you. Good luck for the coalition, but please keep in mind that this has been to be closely connected with the larger effort of the Sustainable Development Goals of 2030. Thank you very much.
Thank you so much for joining and sharing your perspective with us. We now also have Jessica Wyndham, and she'll be the last speaker on this panel. Because of how time is progressing, I will ask you all to make note of the questions that you have, or already put them into the Q&A box, and we will do a joint Q&A a little while later after the next session. So please, everybody, take note of all the things you would like to ask our wonderful speakers. Jessica, are you ready to share with us?
I am. Thank you so much to Gisa, and thank you so much for this invitation to speak. I think it's such a fabulous initiative and a real demonstration of how far we have come. The right to enjoy the benefits of scientific progress and its application was described by Professor William Schabas in 2007 as having a neglected and obscure position among human rights. And happily, that's much less the case now than it was, and that's courtesy of the work of many of you. So kudos to you. When I first began work on the right, also in 2007, it was a right that was largely unknown, it was largely unexplored, and largely relegated to a supportive role for other human rights. While acknowledging that all rights are interdependent, indivisible, and interrelated, the value of the right to science shouldn't only be seen in how it complements other rights, such as the right to health and to food and so on. The right to science has a value of its own, and that's what I want to focus on in my brief remarks today. And I'll also challenge us to think about the question of so what? So what that there is in international law and also in many regional human rights systems a recognition of the right to science. What are or what can be the practical implications of the recognition on paper of the right? And the COVID-19 pandemic provides a clear case study through which to explore that question. And the general comment number 25, adopted by the Committee on Economic, Social and Cultural Rights, just as the world became sort of keenly aware that it was immersed in a pandemic, that general comment offers a number of entry points for our discussion. So I'll discuss the pandemic and what it makes evident in the value and opportunities of using the right to science. Let's start with a quick tour de force of the core obligations of states with regard to the right to science that have a particular bearing on the pandemic. And my apologies if these have been addressed already. But first, the obligation on states to, quote, provide access to basic education necessary for the comprehension and application of scientific knowledge. And I think first we have to recognize this focus on scientific knowledge as one of the benefits of science that I think was less addressed in the early days of conversations on the right to science that really were focused on services and products. But the knowledge derived from science is one of those benefits. And so I would argue this obligation is one of the most fundamental of obligations because it empowers individuals to make informed decisions about their own well-being. Do I wear a mask? Do I socially distance? Do I get a vaccination? It empowers individuals to assess the information that they're receiving, whether from friends and family, political leaders, community leaders, or the scientific community, and it empowers individuals to participate in an informed way in political processes in which understanding of the scientific underpinnings of policies can be vital. That brings us to the second obligation, which is to, quote, align government policies and programs with the best available generally accepted scientific evidence. A public health crisis of the scale of a pandemic in particular requires that government policies and programs be based on science, that they be able to evolve as scientific knowledge evolves, and that the policies and programs be communicated clearly to the general public in such a way that they're understood and supported. Then the third obligation is about communication. The general comment speaks of an obligation to promote accurate scientific information and refrain from disinformation, disparagement, and deliberately misinforming the public in an effort to erode citizen understanding, and so on. Here, the obligation rests with governments, but the question has to be asked and is being asked about how this obligation translates into monitoring, into regulating, and potentially intervening with private actors who, facilitated by social media and other mass communication platforms, spread misinformation and disinformation. And so indeed, the general comment does require that governments, quote, adopt mechanisms to protect people from harmful consequences of false, misleading, and pseudoscience. Then finally, the general comment recognizes the obligation of governments to develop international contacts and cooperation in science. That's taken directly from the language of Article 15 of the Covenant. This obligation reflects both the general obligation recognized in the human rights framework for international cooperation, but is made specific in the context of science. And this aspect of the right to science, and frankly of human rights, remains woefully underexplored in my opinion. And I do wonder whether there is scope to build on our understanding of that obligation and how it might be applied in practice in a way that offers a new lens for addressing issues of disparate access, for example, to the products and services of science, which for the most part have traditionally been addressed as intellectual property concerns requiring engagement of the private sector. And this pandemic has highlighted, again, the power of the private sector to determine who are the haves and who are the have-nots. But at the same time, it's demonstrated that governments can be more interventionist in addressing disparities in access if they choose to be so. And then the last thing I want to say with regard to core obligations of states recognized in the general comment is that I think there's one missing. The general comment recognizes in its substantive paragraphs that science and technology are not always conducted and developed in ways consistent with human rights. And their applications may also threaten, they may undermine, they may violate human rights. And I would argue for an additional core obligation to develop mechanisms for assessing the potential human rights implications of a new scientific or technological development and taking the steps necessary to ensure against negative human rights impacts. In the context of the pandemic, one example of such an assessment that should have been done early on would have been to determine whether the use, for example, of artificial intelligence to monitor movement, to undertake contact tracing, to establish vaccination status, and also in medical devices and processes, including triage, whether they met human rights standards, both during the pandemic and now as we move, hopefully, to a non-public health emergency stage of our existence. So with that review of relevant core obligations, I just want to suggest 5 quick takeaways. Quality and accessible science education for all has to be a priority in formal and informal learning environments. Effective science policy interfaces must be established, including independent scientific advisors and advisory boards, with protections against conflicts of interest and guarantees of scientific integrity and ethics. Transparency has to exist in communicating the science upon which a policy is based, and communication of that science in a way and in forms that will be understandable and accessible to all in society. Measures to monitor and regulate the dissemination of scientific misinformation and disinformation must be adopted. These have to be thoughtfully developed in a way that acknowledges the importance of freedom of expression and explores the role of governments in taking an active part in correcting such misinformation and disinformation. 4th, everyone concerned with human rights and international development, together with government, should explore how the obligation to develop contacts and cooperation in science can be put into action using a human rights lens. What does it mean for the role of communities that are the beneficiaries of development assistance in the design of international aid agreements? What does it mean for prioritization in the provision of aid? And as was just discussed in the previous presentation, do the Sustainable Development Goals, combined with the right to science, offer a way of thinking about these questions in specific contexts? And finally, in the immediate term, technologies deployed in response to the pandemic need to undergo a human rights assessment to determine whether or how they should remain a part of our social and medical tools. In the long-term discussions, we need to engage scientific and engineering communities, industry, academia, and the government in discussions about how to most effectively develop and apply the learnings of human rights impact assessments as new scientific and technological developments arise. They're my brief comments, and I look forward to the discussion.
Thank you so much, Jessica, for bringing these very precise suggestions on how we best move forward, and also for reminding us that we always need to think and look at the things that are missing and that are not yet there in the analysis. And that might be one of the things that this coalition, should it come to fruition, might be able to add. Because of our time, and I see a raised hand, and I'm so glad that people have questions and thoughts. Please enter your questions via the Q&A function. It is the best way for us to collect all of your questions. I was asked that we now move on to the next session, and then we will combine the Q&A of this session and the next session together. So Julia, this is me passing on back to you. Thank you again to all our speakers, and hopefully we'll have you later in our Q&A.
Thank you so much, Gisa. Thanks to all the speakers. It was a very interesting panel. And now I'm happy to invite Marco Perduca, founder of Science for Democracy and former senator of the Italian Parliament, to take the lead for the next session.
Thank you, Julia. Just briefly, the next session will present a handbook on universal health coverage that has been put together, and Neil Datta has already made a list of those that have collaborated over the last 6-7 months. Many of us are here today. Several others have been working from a distance in the past. And so I guess the best way to address this issue would be to invite Caroline Kwamboka and Desta Leku to make a presentation first of the UHC, Universal Health Coverage Handbook, and then to discuss the role of evidence in inspiring change among state and non-state actors. So we have already heard a lot of suggestions, and so we also invite people that make a presentation to end with some points that we can take away later today or in the next few days and weeks. Caroline, you have the floor.
Thank you very much, Honorable Marco. And before I start, please allow me to really recognize and appreciate the leaders that have joined us today. They've been very patient for the last hour as we listened to very important scientific interventions. Honorable Professor Bakari Ouattara from the Republic of Cote d'Ivoire, Honorable Maimouna Ouedraogo, who will be chairing the Parliamentarians Panel today. She's from Burkina Faso. Honorable Abdul Rashid Pelpour from the Republic of Ghana. My very own countrymate, Honorable Denita Gatti, who has been very active even on the chat box from the Republic of Kenya, and Honorable Ernest Mede Wanu from the Republic of Benin, who are with us today. And not to forget Honorable Sibu Sisiwe Masara joining us all the way from Zimbabwe. It's a great pleasure and honor to have such a high power delegation representing most parts of the African continent. For this session, I will be delivering a few remarks and updates regarding the Parliamentarians UHC Handbook. I'm also joined by Ms. Desta Leku from AMREF, and I think it's very important to start by saying the Parliamentarians UHC Handbook idea was born at an AMREF meeting, the Africa Health Agenda international conference that was organized by AMREF in 2019 in Kigali, Rwanda. At that meeting, we had a delegation of 15 parliamentarians who represented different networks from across the continent. And it is there that the idea of merging or having a compilation of a document that can enable parliamentarians make reference to existing and emerging policy change was born. This was really in recognition of the fact that a lot of policy developments have been going on, I mean, through the ages, but I think there's been quite an accelerated increase in these policy frameworks since the SDGs were adopted in 2015. And of course, you will understand this is in a race to ensure that we can attain the 2030 goals for development across the world and across all the sectors. I also wish to share that the Parliamentarians Handbook has gone through, quite a lot of development stages, including experts, and we thank the Science for Democracy team for being part of it. Marco, Professor Boggio, Julia, and the rest of the team has been very important because this is a tool that is envisaged will enable to enhance parliamentarians' understanding on the multiple policy instruments that exist, and that through this they can strengthen the translation of global commitments into national or country actions that are facilitated through the legislative process. And this is important because even the science the right to science protocol that was adopted by ECOSOC in 2020 also benefits from this process of unpacking, enhancing, embracing, and ensuring that parliamentarians across Africa and even in other parts of the world that we work closely with can collaborate more proactively with the globe, to really attain or achieve the aspirations on global health issues. And this, of course, includes global health security. That is very important in our current, world situation. So the current handbook, as I will very briefly present, actually enthuses parliamentarians to strengthen their leadership and ensure that they are able to commit to achieve universal health coverage as one of the key SDGs that is necessary for the achievement of healthy lives and well-being for all at all stages. It also enhances, the understanding of protection, and particularly financial protection, making sure that no one is left behind. The third thing that the Parliamentarians Handbook does is encourages quite reflections on current legislation, identification of gaps so that parliamentarians can better regulate and legislate, creating quite a stronger and enabling regulatory environment within which global health can be achieved. Of course, minding very much that whatever interventions are put in place are responsive to people's needs. It is also an important tool that is enabling and encouraging a lot of advocacy among the parliamentarians that is targeted not only within the House, but also outside the House, which is in other arms of government, including the executive. And, by the parliamentary advocacy, we are better assured that the quality of health systems that serves the people and that the communities can trust is actually upheld. The issue of investment is very important, as you are aware. The parliamentarians hold a very important role in legislating financial policies. And it is through this that perhaps the sustenance of public financing is enhanced and encouraged in favor of health and all the related global health investments that of course include gender, that include other aspects, including even mental health issues and non-communicable. Through the handbook, we have also seen a strengthening of collaboration and moving together of parliamentarian networks across Africa. And as you will get to hear from the panel today, you will realize that from different parts of the continent exists quite the moving together spirit that is very necessary to push for the things that we require. Of course, there are 10 modules, as I will briefly indicate, and then hand over to my colleague Desta to expound on a very important element of how science has been very essential in the Africa Health Agenda Commission. But just quickly on the 10 modules, we have a module on health system strengthening, another one on primary health care, a third one on global health security, a fourth one on immunization, a fifth one on sexual reproductive health and rights, which includes reproductive, maternal and newborn child health and adolescent health, which covers a lot of the elements of ICPD at 25. We have a sixth module on gender equality, a seventh on the human right to science, an eighth on the digital sprint, because we are now living in the digital era or the era of digital interdependence. And then we also have one on the political declarations that have been 10 on HIV/AIDS, and finally on budget appropriation and accountability. Most of these modules and the importance they play in the parliamentary work will be elaborated by the eminent panel of parliamentarians. Over to you, Dexter.
Thank you so much, Caroline, and thank you to the esteemed colleagues for the opportunity to join you today. It's really an honor, honestly, and also to join you today and also to have participated in the review of the UHC Parliamentary Handbook. Just by way of introduction, my name is Desta Lago. I'm the Global Director of Partnerships and External Affairs for Amarok Health Africa, which is the largest health development NGO headquartered in Africa. And we've been driving health change on the continent for more than 60 years. We work very closely with the ministries of health to deliver on health priorities within the countries in which we operate. And our key role really is to bridge the gap between the communities in which we operate and the first level health services. So at the moment, we're in more than 35 countries. We're providing service and programming in 35 countries. We have 8 offices across sub-Saharan Africa and a number more in Europe and North America. And our experience, our over 60 years experience, has really taught us the importance of delivering it, evidence in delivering essential health services and interventions across the continent. So we understand that interventions that are copy-pasted without considering the African context often lacks success. For example, we've seen in countries such as Malawi more recently, where we conducted a study on quality of care. And what the evidence showed that even as we pushed for women to deliver in health facilities, as the WHO had recommended, the maternal mortality rates were still high. And what the recommendations didn't say was that what was required also to make this happen was appropriately trained and adequate numbers of health staff and quality care. Is also needed to see critical improvements in maternal mortality. We also see this now more recently in the case of allocation of funds for COVID vaccine delivery. When the requisite funding for community engagement and health staff are not present to ensure the uptake of vaccines in many countries, what our research shows is that vaccine hesitancy is as high as 40% in some cases. So how do we look at evidence to drive the decision making and the allocation of resources? So these are things that we have always grappled with, and we've always made recommendations to various ministries of health and governments. And so these are the kind of things that we do, and therefore, because our understanding in communities, in African communities, we typically drive an Africa agenda when it comes to health development. And of course, as a trusted intermediary with countries in which we operate, we're often included and sit in on national technical committees and advisories as such. More recently, within regional roles, we are sitting on the Strategic Partnership Coordination Mechanism for COVID Preparedness and Response, and that's the one that operates through the existing Horn of Africa, Eastern Africa, and Southern Africa Humanitarian Health Working Group of WHO, as well as serving on the newly constituted Commission on Africa COVID-19 response, which was established by His Excellency Cyril Ramaphosa, who currently serves as the Africa Union champion for COVID-19. So that's His Excellency President Cyril Ramaphosa. So we are very much engaged at the community, at the national, at the regional, subnational level in terms of health delivery for Africa. So our role on the continent not only includes linking communities to first level care, it also includes leading a very robust thought leadership agenda. And we do this through the same biannual Africa Health Agenda convening that Caroline mentioned earlier. The most recent one that we had was in March 2021, which drew over 3,000 participants from across the world. And of course, previously in 2019, we enjoyed the privilege of hosting the African Parliamentarians. So we've been working very, very closely together over the years. And AHEC itself, which is the Africa Health Agenda, is really a multi-stakeholder conference, and it draws from academia, from government, private sector, development partners, civil society. So it includes a whole range of actors that are really needed to ensure that we are discussing a truly African health agenda and really making progress and recommendations that make sense for the continent. So in this past year, AMREF actually established the AHEC Commission on the state of UHC in Africa. And what a time it was, because we were experiencing COVID globally, and so this was a very difficult time. The AHEC Commission itself was an independent body that was responsible for reviewing Africa's progress towards UHC targets by 2030 and providing very concrete recommendations specifically around leadership, accountability. I mute myself. Sorry, did I lose you? I'm not sure, but let me just continue.
You're fine.
Okay, I'm back. So the commission itself is comprised of global health experts from a range of disciplines and sectors all across the continent, African continent. It was tasked with advising on evidence-based policies that are necessary to shape resilient health systems across Africa to achieve UHC. And it was work of the Commission was also informed by guidance from institutions such as Africa CDC, APHRC, the Africa Academy of Sciences, the Africa Development Bank, WHO, etc. In addition, the commissioners were actually tasked with reviewing more than 75 research articles and books. They conducted more than 42 key informant interviews. They reviewed over 50 citizen stories from across the continent. And, that's how then they came up with the recommendations that they did. And those recommendations are available online. And I'm happy to share with the organizers of this conference so you can review them at your leisure. But just to give you sort of context and background of the continent that is relevant to the work of the Commission, if you'd allow me to provide just a bit of background. So in post-colonial era, Africa was actually very hopeful, confident, ambitious, focused on really ridding Africa of poverty, disease, and ignorance. From about 1960 to around 1980, health policy was driven by African governments and healthcare was considered a human right. However, over the years, with poor governance, economic challenges, dependence on foreign aid, all of this was eroded, and it eroded actually the idea of African solutions. Rather, it embraced solutions from foreign actors, which were not necessarily appropriate for Africa. And then after the 80s, we saw the collapse of some economies. We saw the introduction of the structural adjustment programs, which reduced domestic funding and introduced cost recovery measures, which meant user fees at the point of care. And that really took us back quite a way. And of course, this then coincided with our greatest challenge at the time, which was HIV/AIDS. Now, in the 21st century in which we were moving, we've seen a commitment by the African countries really to make advances towards UHC. We saw that in the Abuja Declaration, in the 2016 Africa Health Strategy, and then, of course, more recently in 2019, when the African leaders met in Addis Ababa to support and commit to WHO's call to action to achieve UHC 2030. So that's sort of the backdrop in which this commission actually set out. And they were tasked specifically to look at what progress has been made by African countries to achieve UHC, what challenges and opportunities currently exist, and then, of course, key recommendations for transformative change to accelerate progress towards UHC. So among the highlighted recommendations, so all of this is really steeped very much in science, in review, in evidence. So the key sort of highlights that I can share with you is health financing continues to be a problem on this continent. And then while health outcomes are improving, which we do see, there remains quite a bit to be done. On the supply side, health sector resources are low and poorly managed, with accountability being a big concern. And then on the demand side, there still continues to be high disease burden and low trust in the health systems. So these sort of are some highlights that have come out. And then the report also outlines, that there are many opportunities we can leverage. Africa is a growing economy. There are very strong regional institutions such as the Africa Union, WHO Afro, CDC Africa that are really strong players. The free trade agreement that will allow cross-border trading on the supply side and the supply chain side. And then there's the untapped potential of a very young population and the demographic divide in general. So the recommendations of the Commission included, first of all, improving and strengthening the health system. And we saw now with COVID how incredibly fragile our health systems are on this continent. So that was a very key recommendation. The need for investments, domestic financing, very, very key. Greater accountability and governance. Investing in health technologies as drivers to deliver health services, and then of course the whole area of manufacturing of health commodities. And then finally, better and more enabling policies and regulatory frameworks. So these were some of the recommendations that surfaced from the Commission's report. And in addition to launching the Africa Health Commission report, the Commission actually developed some very excellent think pieces that are contributing now to our discussions around UHC. And those think pieces looked at, leadership for change. What kind of leadership do we need? Some of the sub-themes were around partnerships. Somebody mentioned earlier, multi-sectoral partnerships being key to deliver on UHC for Africa. Health financing. How do we grapple with that whole agenda? How do we enhance, self-reliance in health, using innovation? How do we reverse legacies of past practices in global health that don't serve us anymore? And then, of course, the whole area of financing, the catastrophic out-of-pocket expenses that people are experiencing at the point of care. The second think piece is focused on health security in Africa. So that's really taking a whole of society approach, addressing lessons that we have learned from COVID-19 pandemic, and then sustaining routine health services during a pandemic, whether it's Ebola, whether it is COVID, et cetera. So what we saw, a very important issue that came out during COVID, it's come out during Ebola really, is around the issue of, for example, RMNCH services, maternal health services, childhood immunizations. In Kenya, for example, we partnered with a group of organizations to provide transport for pregnant mothers to receive their care and for deliveries as well during COVID. So these are really important things. When we see the gains we have made in maternal and child health slide back, it's really important that we strengthen that and we work on that as a priority. And then the third area where the Commission has developed a think piece is around strengthening accountability mechanisms. How do we ensure health for all? And how do we accelerate the pace to achieve inclusive global health? So those were the sort of three think pieces that came along with the recommendations, which are fairly robust and have many more things that I've included in this brief discussion. But what I can assure you is even as we continue to disseminate the recommendations, we are already seeing some traction. And for example, President Uhuru Kenyatta of Kenya has requested the AHEC Commission report to review with his team. Two of our commissioners have been requested to or adopted into the Ramaphosa Commission under the Africa Health, Social and Economic Recovery Committee, where the recommendations of the AHEC Commission report will be used. So I think for us and for the work that we're doing, it will be really important to have the African parliamentarians support and continue to work closely with us. I think that's what we need, partnerships, not just within Africa, but outside to accelerate UHC. And so we look to the leadership of all of my colleagues on this call. And I thank you sincerely for allowing me the opportunity to speak to you today. So over to you again, Caroline. Thank you.
Okay, thank you very much, Desta, for the in-depth and detailed, explanation that helps us all understand what the EHEC Commission has been doing and how much value you have added as we work to develop the Parliamentarians UHC Handbook. So without much ado, I give the floor, I don't know whether to give it to Marco or just to go to proceed to my chair, Honorable Mike.
I can take it from there, Joseph, for a few words. Thank you, Caroline. Thank you, Desta. We hope also to have Amref with us if we're able to launch this coalition. C'est avec plaisir que je donne la parole maintenant à Madame Moimouna Ouedraogo Sawadogo, qui va introduire et conduire notre prochain panel avec les membres du Parlement du continent africain. Madame, vous avez la parole.
Et voilà.
On vous entend.
Oui.
We can hear you.
Vous m'entendez?
Très bien.
We can hear you.
Okay, merci. Et avant tout propos, je vais vous informer que les
First of all, I'd like to say that the deputies, the parliamentarians, are following our session. The honorable parliamentarians, ladies and gentlemen, this is a very interesting presentation, a very interesting session. I thank you for these remarks. I'm the coordinator of the parliamentary network in Burkina Faso for health and development. During the session, there will be contributions and comments by experts on the handbook on universal health coverage. We'll be talking about right to health and about key aspects of how to get the key actors involved in the issue of promoting health rights. Among the speakers, we have Mrs. Kwamboka from the European Parliamentary Forum, Mrs. Destalacchio, who just took the floor, and Mrs. Caroline Kwamboka has the floor. You have the floor. You have 6 minutes, Caroline, to tell us briefly what this handbook for parliamentarians on universal health coverage is all about.
Thank you very much.
Thank you
for the invitation. I think it is okay for me to submit to you, my Honorable President, that we have already highlighted together with Desta. and it is okay for you to proceed with the parliamentary.
Ok, donc on peut aller alors.
Merci.
Merci. Dans ce cas, nous allons demander à Madame Desta.
Well, in that case, I'll ask Mrs. Desta what AMREF has done so far about universal health coverage.
Yeah.
And what can we do in order to change the role and attitude of actors, state and non-state actors? You have the floor, Mrs. Desta Lakio.
Thank you, Honorable Maimuna. I appreciate that notice. I think I have covered largely what we have done with the AHEC Commission and the recommendations from the Commission. I would say that in this time, particularly in a time of pandemic, it is critical that state and non-state actors work together. My role as a global partnership director at AMREF really has shown that without government, private sector, academia, development partners, and civil society participation, it is very difficult to address many of the health needs that we have. I specifically worked on the global security piece of the handbook, and global security and UHC are really two sides of the same coin, because for UHC to be successful, you need a very strong health system. So in my view, in order to strengthen the health systems, in order to strengthen the supply chains, in order to strengthen and increase the capacity of health workers across the continent, we have to work together as partners. So that's, I think, Honorable Maimuna, that's what I would add to what I have said earlier, and I thank you, the appreciation for calling upon me.
Ok, merci bien. Nous allons vraiment remercier Madame Desta.
Well, thank you very much, Mrs. Desta, and now we can open the Parliamentarians Panel. And in the panel, we have several speakers whom I'd like to thank. I'd also like to thank all the friends and partners who played such an important role in preparing, in drafting the handbook for parliamentarians on universal health coverage. And first of all, I'd like to speak about the importance of science for the advancement of local health systems. I'm happy to get this panel involved in this discussion in a plenary session. Before we start, I'd like to introduce the members of parliament who will be taking the floor. Honorable Ernest Medeguano, a member of parliament of the Republic of Benin. He is a member of a committee that focuses on UHC, and he'll be talking about primary health care as a cornerstone of achieving universal health coverage. Then we have Honorable Denita Gatti from Kenya, from the Parliament of Kenya, who's also a member of the Committee on Sustainable Development Goals. And he advocates health to a right to health and to sexual health, and he'll be talking about the importance of science in achieving gender equality. After that, we'll have Honorable Abdul Rashid Hassan Pelpo. I apologize for the pronunciation if wrong. He's a member of parliament from Ghana, and he chairs the Parliamentary Commission on Population and Development and Health. He'll talk about the key role that evidence plays in tracking progress towards the ICPD 25 promise of universal health care and primary health care. And then we'll have Honorable Sibusisiwe Masara, a member of parliament from Zimbabwe, president of the Women's Committee. And Honorable Masara will speak about the important role of science in influencing parliamentarians in order to advance immunization. And last but not least, Professor Bakari Ouattara, member of parliament from the Côte d'Ivoire, Ivory Coast, who is a champion of the committee that attended the 6th conference on freedom of scientific research in Addis Ababa.
Il expliquera l'importance de la
he also took part in ECOSOC's efforts towards better healthcare, and he'll speak about the importance.
Sont l'institution centrale par laquelle les lois sont votées.
Parliaments are central institutions that pass laws, and governments are considered are accountable for, responsible for implementing these laws. Budgeting is important, and the analysis of laws before and after they're passed is important, especially in the field of global health. The mandate of parliamentarians is to act on concerns and urgent concerns for voters and for nations. Promoting the role of parliamentarians in order to achieve global health is a commitment for us, members of parliament, and we commit ourselves to draft agendas and to implement programs through 6 stages, different steps, guaranteeing political leadership, protecting citizens, not leaving anyone aside, and financing global health, universal health coverage, creating a political environment that is strong and sound and that meets the population's needs, and to advocate the creation of quality health systems, healthcare systems that are trusted by the people, investing more and investing better by involving public funds and cooperating with among parties, having multi-party mechanisms through which the entire society can be involved in the effort to achieve a healthier world. Science is a key engine, is a key factor, and the Handbook for Parliamentarians on Universal Health Coverage is an essential tool, providing us with the capacity and the evidence we need in order to act.
Réalisation de la santé globale. Nous prenons également
to promote universal health coverage. The Handbook for Parliamentarians is going to be essential in order to raise awareness and to make people accountable as far as health care is concerned and health-related issues. These issues being essential in our parliamentary debates. There is a joint effort on the part of the African Parliamentary Fund, APF, FUNFPA, and Science from Democracy. These organizations made all of this possible, and now I'd like to invite my fellow speakers for the presentations. And the first speaker is Honorable Ernest Medewano from the Benin.
Thank you, Madam
You have
Chairman.
the floor. 5
Sorry.
minutes.
Thank you, Madam President. I am a member of the National Parliament. I am the coordinator of the Parliamentarian Network for Cooperation and Development. Can you hear me?
Can you hear me?
Yes. I was asked to talk about the fundamental role that can be played in the healthcare sector. By the parliamentarians. In the Benin Parliament, we have voted different initiatives and also we have implemented some actions, and we've seen that there is very close link between healthcare and follow-up. Very close link, I would say, between primary care and the universal healthcare coverage. I will present the action that the Network for the Development of Healthcare in Benin has proposed to the government. I would also like to say that I'd like to say to all the honorable members of parliament, I would like to thank them on behalf of the Benin Parliament, Honorable Mamouna Ouedraogo, who is the chair of the panel, who is also member of Parliament of Burkina Faso, the president of the Parliamentary Network for Health, Population and Development. I'd like also to thank all the partners who participated and gave their contribution to the organization of this meeting. Ladies and gentlemen, I was asked to talk about the fundamental role that primary care plays in society, especially if we consider the universal health coverage. And I would like to go back to primary care and the importance of primary care in the African continent. As you know, primary care is an approach to health that takes into account the healthcare needs of the whole population. The aim is also to guarantee progress level of healthcare and well-being to the whole of the population and the highest possible level of service. This is an approach that tries to guarantee a fair distribution of healthcare, prioritizing the needs of the population. The health objectives are part of primary care and prevention of diseases. And palliative care and other treatments. Primary care represents for African countries and for our populations, in particular the most vulnerable population,
a very important tool. Thanks to primary care, the basic healthcare offer is guaranteed. This means that most of the health problems can be solved if primary care actually works. So primary care plays an invaluable role if we want our social systems to work at all levels. I'd like to talk about the universal health coverage. This universal health coverage is a key objective if we want to develop properly our health systems. The issue of funding of healthcare systems remains a current problem and it persists. In all our debates about healthcare, it comes up. If we want to promote the universal healthcare coverage in all our countries, in order to protect our own population, we need to be realistic, ladies and gentlemen, and honorable members of parliament. Rules and regulations are not sufficient to cater for the basic healthcare needs. If we want to be effective in our action, if we want to have actions that follow what we're doing here today, we need to make sure that every single action is assessed. So that means that when people access primary care, they have to find a system that works and a health policy that works and that caters for the basic needs of the population. So I insist on the essential role to be played by the primary care health system, which is the key for the universal healthcare coverage, especially when the population will be able to access primary care services that actually are efficient, that actually work. And in this case, we will have universal health coverage. Universal adhesion to the universal healthcare system is the only way to move forward. So, linking primary care systems to the universal health coverage is essential to make progress. So we have to work on that, focusing on primary care in order to guarantee the success of the universal health coverage from today to 2030. It's a daunting challenge and a collective initiative, a collective effort is needed in order to identify the main issues and find solutions that are enduring in the long term. Now, I'd like to say, besides what was already said, that this is an important topic to deal with, that is linking primary care systems to the universal health coverage. Thank you for your attention. And I will conclude by mentioning an aspect that clearly shows the link between primary care systems and the universal healthcare coverage. Because in Benin, workers and employers share the healthcare costs. So the employers pay half of the healthcare costs for their employees. But this is in the formal sector, but in the informal labor market, in the informal sector, workers have to fully pay for any care. And if we want to have, as I said, universal health coverage, we need to set some stages and start with giving free access to primary care. If you go to the rural areas, for instance, there are a lot of problems because people don't know about their rights. They think they have to pay healthcare services out of their pockets. So we also should work on raising awareness about people's rights to health. And we should inform them of the importance of free access to primary care. But when this issue is not taken seriously, then it's not possible to move forward, to make progress. Obviously, situations vary from one country to the other. Thank you very much. I think you've exceeded the time allotted to you, but it's important to speak about what goes on in Benin. But then I will present the various points to the forum. Thank you very much. Extremely interesting. We haven't got enough time. Thank you very much for your contribution. I now give the floor to the representative of Kenya. 5 minutes.
Denita a la parole. Denita.
Yes, I hope you can hear me.
Very well, thank you.
All right, thank you very much, and good evening from cold Nairobi, Kenya. And I'm very happy, and thank you, Madam Chair, Honorable Maimuna, for the opportunity to actually be able to talk about this very important topic that is health and health financing, and health as a human rights issue. I am a member of Parliament in the Kenya National Assembly. I do consider myself a gender and disability champion, and therefore I'm happy that we are discussing this issue. That is the importance of science in achieving gender equality at a time when we have come out of the COVID situation. And for me, really, it has been a time, even within our own country as Kenya in East Africa, and generally countries of the African continent or the world, to really examine where we are going wrong when it comes to issues of healthcare and health generally, because we have really suffered a lot. The impact of COVID, for example, in our time and in our country, and is glad that we are discussing this topic. I am also a member of the Sustainable Development Goals, the SDGs caucus of Parliament of Kenya, where we really do a lot of work around the issues of healthcare, universal health, that is SDG 3, and looking at the intersectionality of that health and gender in general. And we are therefore noticing and we're playing a key role. We as members of parliament in Kenya and also under the SDGs caucus of parliament, we have been very instrumental in validating the UHC handbook that has been produced and really looking at what we can do as members of parliament to actually lobby our colleagues in the House to be able to really advocate for health financing. I've had my colleagues talking about the issue of health financing, which is a big problem in most of our countries in Africa, especially, where we do not really allocate enough money to cater for issues to do with health. I mean, our budget, our national budgets are lower. And therefore, for me, this is an opportunity looking at the handbook to push for proper allocation of our national budgets to health financing, to be able to move that agenda. It is a fact that millions of girls and women are generally invisible when it comes to issues of health issues. We continuously remain disadvantaged because of our culture, because of our barriers that do exist amongst women and young girls. And therefore, you will also notice that those women and girls with disabilities are extremely disadvantaged, because I am a woman member of parliament with disability, for example. And therefore, in those kind of negotiations, we have not seen women feature prominently when it comes to issues of healthcare. Madam Maimuna, you will notice that you also realize that the UN Women Policy number 18 really talks about the issues of the role of women and women as having key roles in, especially during this period of COVID-19. My country, that is Kenya, has been quite instrumental. I mean, you will remember in 2019, when we had the ICPD plus 25, the Nairobi summit really was in Nairobi, and we actually had our President Uhuru Kenyatta, really put a lot of emphasis on advancing and promoting healthcare financing so that we're able to tackle these issues. And we cannot tackle healthcare. We cannot tackle health without tackling sexual reproductive health. That is huge in Africa. It has always never been discussed. Issues of sexual minorities, issues of budgeting for women with disabilities, when we are talking about issues health, we have tended a long time to focus generally on the general health, assuming that we have many other issues that really make health a difficult topic to handle as a country. My president, that is President Uhuru Kenyatta, has also just come from Paris, where there was the summit, the Gender Equality Forum, talking about issues of gender and putting together, financing and supporting initiatives like that. I think for me this is huge. And when you look at the handbook, the UHC handbook that we have as members of parliament, our role in Kenya as of now is basically to look at the various modules. Module 6 is the gender aspect. And therefore looking at how then do we ensure that this module really takes into account and recognize the role that women play in terms of healthcare. Again, if you look at what has been happening for us in Africa, as a member of parliament, I have seen situations where the role of women, especially in issues to do with research, in issues to do with science, in issues to do with, all these issues that women are not very prominent. And therefore, as members of parliament, for me, I feel that we can actually have a responsibility to push forward the budget to ensure that women who are a majority of frontline workers, I mean, look at the COVID period, we saw so many women who are frontline healthcare workers who are less paid, for example, who are actually do not even, sit in decision-making tables of global, healthcare, global services, health services. So we have a responsibility and a duty as members of parliament to basically ensure that the challenges that continue to face women, because they are many, they are complex. The intersectionality, for example, of gender, disability, LGBTI issues, there are things that we need to bring about issues of sexual reproductive health on the floor of the House, on the floor of Parliament, to be able to address. So moving forward, I have a feeling, and a strong feeling, that healthcare financing, we as members of Parliament, we can actually lobby and increase our national funding and our national budgets to ensure that healthcare financing is given priority. Health must be inclusive. Health must be quality. Health must be affordable. In Africa, we have seen these situations that are not really good. We continue to lag behind when it comes to budgeting, proper budgeting, and allocating enough money that takes care of health. I mean, after COVID, you saw that, it dawned on us that we really do not have adequate facilities to handle, emergencies like COVID-19. And therefore, for me, that is what I feel. Our country, that is Kenya, and many other African countries, and like many other countries of the world, have actually signed a lot of, these, protocols and treaties, but again, implementation continues to be a problem. We have signed, for example, the Maputo, that looks at issues of women and maternal health and the SRH matters. We have also signed the Abuja Declaration, but we do not have enough sufficient funds to give that. I want to call upon members of Parliament. I want to call upon my colleague members of Parliament from Africa countries and all over the world to really prioritize health financing in Africa, and to ensure that we continue to promote our various caucuses and committees of the Parliament, to ensure to continue to promote parliamentary partnerships with, for example, the network that is about to come up, or the network that exists. We would be interested to continue to advance the issue of campaigning for healthcare, for health financing in Africa as a region, and to continue to also to ensure that we have responsive budgeting. That is what we can actually call on the floor of Parliament and on the floor of the House. That is what we do in Nairobi, and we do hope that we continue through the support and partnerships that exist now, and especially this partnership, this coalition that we want to form, so that we are able to advance this agenda, even on the floor of the House. I really want to thank you very much for listening to me, and tell you that I am here, and we are here as the SDG caucus of Kenya Parliament to continue advancing this cause. Thank you, Caroline. Thank you, Madam Maimuna, and thank you, Imelda, and everybody else for listening to me. I thank you.
Merci. Merci. Nous allons vraiment, le sujet est vraiment passionnant. Nous allons remercier.
Thank you. The topic is very interesting. Thank you, Mrs. Denita, for raising this issue. Let's now write down the questions, if any, in the chat. And now I give the floor to Abdul Rashid Hassan Pelpo, who's a member of Parliament of Ghana, who has 5 minutes time to speak.
In the meantime, can I jump in to recommend, please, to stick to the time allotted, because otherwise we will not be able to allow all the other speakers to take the floor. Thank you very much, Madam Chair.
Tout à fait. Allez, Abdul, vous avez la parole pour 5 minutes.
So, yeah. Honorable Abdul Rashid Hassan Pelpo, you have the floor.
Il n'est pas là? Non.
Si Abdul n'est pas disponible, nous allons donner la parole à l'honorable Sibisis du Zimbabwe.
So we give the floor to Busiwe Masara from Zimbabwe. 5 minutes.
Masara.
Il n'est pas là non plus. Il y a eu des problèmes avec son Internet avant.
Ah, ok. D'accord. Donc, nous allons donner la parole à l'honorable Bakari.
He's not there. He's had some internet connection problems. So the honorable member Bakari Ouattara from Ivory Coast. Thank you very much, Madam Chairperson. We're very happy to see you again on these screens. And so I would like to comply with the time allotted to me, 5 minutes. So, honorable colleagues, my colleagues have already highlighted in different ways the problems concerning universal healthcare coverage and the right to health for all. Now, I'd like to focus on the topic that everybody's mentioned so far, and that pertains to a principle. When you do not analyze the financial aspect of any business, you can't launch anything, any business. So talking of budgeting, we have to define operational tools, having a more sophisticated tax framework, including the Treasury, the tax office, the Parliament, in order to have enough tax proceeds to fund the healthcare system. In a lot of countries, this is indispensable if we want to have local, national, and universal healthcare coverage. So that means we need to have access to information, and we should move from a passive to an active approach to healthcare. So I think that we should try and use the power of the financial markets to set global health objectives that are attractive. We know that not all the countries have the best economic situation. Not all of them are capable of attracting investment. So we should invite countries that should increase their budgets to healthcare services. So parliamentarians have to be able to analyze budgets, assess the quality of service, the level of service, and report about it in details, with financial details and also details about public funding to development, to give visibility to what the government, what the state is doing. The parliamentarians should follow what comment 25 says, that asks for a follow-up to aid to African countries. I'm happy to see that this handbook has stressed these principles and these recommendations in such a forceful way. We, parliamentarians, can use it to raise awareness about global health coverage and to try and put pressure to obtain more funding, and to also put pressure on transparency. We also have to support the handbook when it speaks about macroeconomic indicators, because these are very important. Members of Parliament can also have a key role as auditors to see that actually all the principles and the approaches of the handbook are actually implemented in view of sustainable development. This would help to better use funds and aid to cater for the needs of the population. I was very fast, but I tried to comply with my time limits. So thank you very much and congratulations to Honorable Bakari Ouattara, who respected the time limit. Thank you very much for the quality of your contribution. Thank you very much. Thank you to all the members of parliament for being so effective with your contributions to this debate, which is a very high quality debate. We need to create the correct environment for the universal health coverage. All the contributors have explained that science is a right and involves all the health care aspects. So I'd like to thank all the panel members. I'd like to thank Caroline for organizing this panel and all those who have worked to make this panel possible, and all the members of parliament who have attended this session. So see you next time. Thank you very much for your attention. See you next time. Thank you to you, and thank you to the other members of the parliament for participating in the debate, for your requests and suggestions. We prepared a draft of a resolution that we will share after the webinar. I saw that Cesare Romano is professor of international law at Loyola Law School in Los Angeles, who would like to take the floor and talk about the provisions that have been implemented thanks to this idea of science as a human right. So the floor to Cesare Romano.
Shall I speak English, French, or Italian? I'll speak English, if you don't mind.
Étant donné que j'enseigne aux États-Unis, je passe tout mon temps en parlant en anglais, c'est plus facile.
Italian is my mother tongue, but as I teach in the US, it's easier for me to speak in English.
And I have to add something. So the perspective that I'm doing my intervention, so that you understand where I come from, is that I had the chance to litigate the so far only case ever litigated internationally, raising the question of the right to science. And this was the case of SC and GP versus Italy that was brought before the Committee on Economic, Social and Cultural Rights of the United Nations as an individual communication in 2016. So some of the lessons that I learned litigating a case are going to inspire my short intervention today. I was listening with great interest to the speakers coming before me. And if I can find and detect a common thread throughout everything I heard, and in particular a point that had been raised by Honorable Gatti, was that yes, the right to science is recognized in all these conventions and protocols every night. It's so nice and fine, but the question, what about implementation? I would like to offer a perspective. Implementation can be achieved essentially in two ways. One is the political way, the tool of advocacy and insisting, and the presence of so many members of the African parliaments in this gathering. It reassures me that there is definitely a political awareness of this right and the importance that there is to insist on that. But there's also another side to this battle, and is the question is that to use international courts and tribunals, to use judges, to use adjudicating bodies, to come to decide cases that raise the question of the right to science, and possibly to win these cases, so that eventually we have another angle to promote the right to science. So what are the fora that can be used? Well, as probably some or many of you know, international human rights are protected essentially in two levels. One is the global level under the aegis of the United Nations and its treaties and its bodies and mechanisms and so on and so forth. Another one is the regional level. And at present time in history, we have 3 plus 2 emerging regional human rights systems at various degrees of development. So at the global level, the forum where to litigate the right to science is under the Covenant on Economic, Social, and Cultural Rights. As you know, Article 15 of that treaty protects the right to science and many of its components. The optional protocol to the Covenant on Economic, Social, and Cultural Rights creates a possibility of giving individuals in the countries that have ratified the optional protocol to bring an individual communication before the committee. So far, 26 countries have ratified the optional protocol. It might sound like a small number, but like in international law, everything always starts small, but over time develops. Of these 26 countries, there are at least 2 African countries that have ratified the optional protocol, and they are Niger and Gabon. So we have something to start there. As I said, I had the chance to litigate the right to science in 2016. I have to say, unfortunately, the outcome was not positive. I mean, we won the case on the right to health, but we didn't win the case on the right to science, mostly because the committee felt that it was a little bit too advanced, a little bit too early to start getting into such a difficult terrain. But they left in the decision very clear indications of how a successful case litigating the right to science might be framed. And anyone who has been paying attention has taken note of that. And we will definitely at some point try again. Talking about the regional systems, there are interesting developments. Unfortunately, Europe doesn't have the right to science as such codified in any of its human rights treaties. That is for historical reasons and a certain diffidence towards economic, social, and cultural rights. But there is at least one aspect of the right to science, if you will, of the rights of science, if not to science, and that is academic freedom, which is protected in the Charter of the Fundamental Rights of the European Union. Going to the Americas, the Western Hemisphere, there are more interesting developments there. The right to science is protected in Article 13 of the American Declaration of Human Rights and in Article 14 of the Protocol of San Salvador to the American Convention of Human Rights. The Protocol of San Salvador in itself is not justiciable. That is to say that it cannot be invoked before the human rights bodies of the Inter-American system. However, there is a very interesting article, which is Article 26 of the American Convention, which is justiciable because the Inter-American Court has jurisdiction over violations. That says that states, members of the OAS, have an obligation to implement the economic, social, and cultural rights included in the Charter of the Organization of American States. That article has been largely dormant for most of the history of the Inter-American Court until about 10 years ago, some very smart and entrepreneurial advocates start invoking it before the Inter-American Court. And in February 2020, the Inter-American Court passed a decision, which is a landmark in the case of the Laca Hohat indigenous communities in Argentina, where it found a violation of the right to culture, which, as we know, it's always strictly associated with the right to science, but also the right to health and the right to a clean environment, the right to water of these communities. So by doing that, by using Article 26 to extend essentially its jurisdiction to economic, social, and cultural rights, the Inter-American Court has opened a door that now could be potentially used to finally bring the first case dealing with the question of the right to science before the Inter-American Court of Human Rights. And then there is Africa, right? Many of you here come from that beautiful continent. The right to science is not codified in the African Charter of Human Rights, in the Banjul Charter. However, there are 2 options. One is there is a provision in the Charter of the African Union, which is Article 2.2, that makes a commitment of states to develop and back and science and invest in science. There is also an interesting provision in the protocol of women, the Maputo Protocol to the African Charter, also making a commitment on investment on science. But as far as the question of the justiciability in Africa of the right to science, then I need to bring the attention of everyone to Article 28.c of the Statute of the African Charter of Human Rights, which gives very interesting jurisdiction to the African Court of Human Rights for violations not only of the human rights instruments of the African Union, but also any other international human rights instrument that has been ratified by African states. No one has yet tried to invoke this provision before the African Court. The African Court itself is a very young creature. I mean, it has been operating now for about 10 years, but there has still to develop a jurisprudence. But this is a possibility that might be tested. If we were able to find a good case in Africa that checks all the technical boxes of administering jurisdiction, we could try to see if it's possible actually to successfully invoke the right to science before the African Court. All of this to finish, and I'll wrap up quickly. What are the advantages and drawbacks of a strategy to promote the right to science that uses litigation as a tool? The advantages, of course, is that when you do a case, you focalize everyone's attention, right? We go from talking about the right to science in abstract to applying the right to science to a specific instance. And by going from the general to the specific, it helps focalizing minds and help also putting things in context and makes it easier to understand what the right to science actually entails. The second one is that you have a story. And very often it's a very powerful story, right? The story of the victims whose rights has been violated that can be used to actually, if it's picked up by the press, to tell the story to a public and make the case known to everyone, and by extension also the right known to everyone. 3, you put pressure on governments, right? There's nothing like being able to go to a state representative and wave in front of them a judgment and say, but you have an obligation to do this because a court told you to do that. And that is a very powerful tool, more powerful than simply going before a government and say, you should do this because we think it's a good idea. And fourth, and is, as a law scholar, the most important thing to me, it helps developing a jurisprudence. International law is not only made by states directly, but also indirectly through international courts and tribunals who, by deciding cases, create jurisprudence that builds up the body of international law. So the right to science right now is developing. We need to add a little bit more of flesh around the bare bones of these rights, and the contribution of international courts could be essential to that point. And we need to activate them in order to be able to achieve that. Of course, there are also downsides. The downsides is that proceedings are very lengthy before international courts. It takes many, many years before a cause runs all course from filing to the decision. We're talking about 4, 5, 6, 7 years, maybe. Second is that, of course, every time you go before a judge, there are unknowns, right? You cannot predict how the judge will react to the argument you make. And actually, there's even a chance that might backfire, right? You go before a judge with the perfect intentions, thinking of that you will advance international law in your area, but you end up actually taking a step back because the judge disagrees with you and therefore closes the door on possible future litigation. And third, there is a problem of implementation. As I say, having a judgment to wave in front of politicians to say you have to do this because a judge ordered you to do that, it's an advantage. But at the same time, the answer of the national politician is that, yes, but this is an international court. An international court really doesn't have the power to compel me. So we need to create an alliance between international judges and national judges, right? To be able so that one helps the other implementing the right. Okay, I hope I haven't gone too long with the time that I was allocated and have been clear enough. And thank you very much, Marco.
Thank you, Cesare. You have respected your time and also a lot of suggestions that I will pick up later on, because I see that the Honorable Sibusisiwe Masara is back online. We apologize for the before. And she has the floor for her speech, and then we go back to the issue of the coalition and why also everything that has been said today should also be coordinated in a different fashion for the future, also to try and push for advances in international law and all the other human rights that have been mentioned this afternoon. You have the floor, Honorable. Honorable Sibusisiwe Masara, are you online? Can you hear us?
Yes, she's online. Honorable, you can unmute. The floor is yours. She is online.
We might have lost her once again.
Oh, sorry.
So I see her.
She's here. She's here. Honorable Sibusisiwe, the floor is yours. I think there's a challenge with network in Zimbabwe, but she's been prepared for the session for quite some time, and she was really willing and looking forward to make her brief submission. Honorable Sibusisiwe, if you can hear us, please take the floor.
Okay, well, if she comes back, I can be blocked, and then we go back to her, because we're nearing the end of the time that we decided to go through. So let me try and sum up some of the ideas that have been floated and why we have decided to convene this first event, in which we have scholars, human rights advocates, experts, and members of parliament. And I would like to start with another victory that Cesare has been achieved a few months ago. And this brings together all the various stakeholders, because on the one hand, we had a couple of members of an Italian political movement that in 2013 were promoting a national referendum, and they weren't successful because some of the laws adopted in the 70s were not allowing a full enjoyment of civil and political rights in Italy. Thanks to Cesare, in 2015, the case was filed before the Human Rights Committee at the United Nations, and so addressing the other international covenant, the one on civil and political rights. I see the Honorable is back with us, but let me finish. So in 2019, a set of observation was adopted by that committee and sent to the government of Italy, shared with members of parliament, and thanks to an extensive dialogue among those in the opposition and majority, laws were changed up to a point in which some of the observation has been now become Italian law. While we're speaking, they're still discussing additional elements to be added to the laws adopted last year, so that possibly by the end of this year, digital democracy in Italy will no longer be just a slogan, but something that can be activated. So it took 9 years, 8 years, but at the end, we made a series of steps in the right direction. And the direction was that to oblige a member state that has ratified the covenant to fulfill her international obligation. So this is the reason why we think that not only the more the merrier, but the most effective we can be with all the expertise and knowledge that has been shared today. So, Honorable Sisi, can you hear us? Sibusisiwe, Mazara? No. We lost her again.
Yeah, I think our colleague Sonia is able to call her into the call. So that she can use a different method. I think it's okay. Sonia, please proceed.
Yes, I'm just getting her on the line. 1 minute, please.
So, but it is, of course, the main focus of a coalition for the right to science will not only be to activate existing human rights mechanism or go to a court. There are diplomatic, political, and non-governmental ways to promote the affirmation of the right to science in different quarters and at different levels and with different allies. the idea of looking into the possibility of launching a coalition also goes back to some of the examples that have been made by Filomena Gallo and also by Ezio. I think the UNAIDS is the product of a coalition of groups that is that have worked together first at the national level and then at the international level with member states of the United Nations and also private donors and philanthropies groups that I have now launched the Global Fund, and now we have a UN agency dedicated to that. Landmines are also another example of how a synergy between non-state actors and member states can also bring about great changes in international law. The Coalition for the International Criminal Court that was set up 26 years ago was the driving force for having a diplomatic conference finally convened to arrive at the final version of a statute. So not only there, it was the international humanitarian law was amended or developed, but an institution was set up because of this synergy between non-state actors and a like-minded group of countries. The abolition of the death penalty, even if it's not a universal deal, yet through a series of resolutions adopted by the General Assembly, we have seen that document being taken at the national level to try and at least suspend, have a national moratorium of capital execution and save the life of thousands, if not tens of thousands of people. These are all examples of, and female genital mutilation is also another example of how coalitions of non-governmental organizations, experts, women activists have been able to promote and strengthen human rights through the activation of existing mechanisms according to international law. So we wanted to have a survey, an online survey. We don't have any time, and I'm trying to speak as much as I can to see if we can actually find the line to have our honorable from Zimbabwe to go back and say whatever she wanted to share with us. But we have drafted in the last couple of months a short statement to launch between now and say the fall this coalition, and this is what it sounds like. The Coalition for the Right to Science, launched in 2021, will bring together individuals, organizations, and decision makers working towards the affirmation of the rights to science as defined in Article 15 of the International Covenant on Economic, Social, and Cultural Rights of 1966, and further explained in the General Comment number 25 of 2020. Membership is, of course, open to all those that pledge to contribute to the global protection and promotion of freedom of research, participation in the scientific process, open, fair, and equitable access to knowledge and data, and the enjoyment of scientific progress and its application in line with the full respect of universal fundamental human rights. Now, we drafted this together with everybody, with all the co-promoters of today's event, but I think each and every contribution that we heard today have all gone in this direction. And so we will email all those that registered. And I think we had more than 250 people that registered for today. And at the peak, we had over 100 all listening in the Zoom room and online via Facebook or YouTube to ask them to endorse this statement. In addition to that, and also...
Okay. Sorry, Marco.
That's okay.
Apologies. Yes, please go ahead, Honorable Sibusiso is on the line.
Okay, sure.
Okay, thank you very much. Allow me, Honorable Chair, to pick up this discussion where my colleague, Member of Parliament from Ghana, has left. Distinguished guests, ladies and gentlemen, before we all became members of Parliament, we were active members of our communities and we served in different callings and careers. Most of us are members of the movement that strongly advances justice, and we represent the bridge between the electorate and the executive branch of government. Not only for accountability and oversight, but also for acting on emerging issues of concern. Fellow members of Parliament, distinguished delegates in attendance, humanization is one of the most outstanding success stories that demonstrates the value of investing in our health. With a return on investment that is unparalleled in terms of effectiveness and cost effectiveness. Expanded immunization coverage prevents disease and saves lives. Immunization is an essential component of the global push for improved primary health care, universal health coverage, and a global security. Building resilient and sustainable immunization systems, therefore, is key to sustaining a high vaccination rate and helping communities protect their most vulnerable from life-threatening illnesses. Public trust and confidence are at the core of successful immunization programs and are crucial to efforts to challenge this. To see and hear the things and misinformation being spread about vaccines, yet vaccines are a true product of a science that holds the key to protecting population. An immunized population is a healthy, productive population. Preventing infections is less costly and less time consuming than treating them, which reduces the burden. As parliamentarians, we have a key responsibility enabling a safer, healthier, and more prosperous world. COVID-19 has taught us that pathogens are not bound to our borders. Supporting the detection, prevention, and response to infectious diseases through policy and legislation is therefore key to achieving global health security. Allow me to affirm that we thank the experts under the leadership of African and European parliamentary secretariats for leading the development of the Parliamentarians UHC Handbook. As parliamentarians, we take note that the parliamentarian has a whole module dedicated to immunization and raw immunization, and vaccines play in keeping our communities safe from the preventable and infectious diseases. Immunization is the best push for human growth and development, best and surest strategy to aid the achievement of health. I therefore call upon my fellow legislators to support the establishment and strengthening of emergency preparedness, response systems, and mechanisms that are integral to infectious diseases control and health systems strengthening. Let us invoke our oversight mandate and ensure that state parties take key steps to embrace the right to and covenant and work towards achieving full realization, conservation, development, and diffusion of science and culture in line with provisions of General Comment number 25 of April 20. And I don't know what I can do because in terms of preparation, I also prepare something for Zimbabwe, what we are doing right now. I don't know whether I can I proceed, Madam Sonia?
Well, unfortunately, the connection is very bad, and it's difficult for the interpreters to understand in detail and translate into French and Italian. So if you could conclude, then we will have certainly other opportunities in the future also to provide better connection. I apologize, Honorable.
Thank you very much. I assume you are telling me that you hardly hear him, but you have tried to give me the opportunity to present. Thank you so much, everybody.
Okay, I'm not sure I heard correctly. So the presentation is over, Sonia?
Yes, she sent her thank you. She was just saying thank you that she has concluded her remarks.
Okay, but and we apologize for this connection issue with all the speakers and also the audience. We are running very late. I think we are very happy about the level of the debate and all the suggestions that have been put forward by experts, scholars, human rights activists, and also members of parliament. And in particular, we are very happy to have had the opportunity to engage at this very early stage members of parliament, because themselves and their governments can do at least 2 or 3 things that are necessary for the right to science. The most important would be to initiate all the national procedure to ratify what Cesare Romano has mentioned before. That is the optional protocol to the International Covenant on Economic, Social, and Cultural Rights. Because without that ratification, there will not be a quasi-jurisdiction to trigger for citizens of that country to launch, to file individual complaints. The second would be to spread as much as possible the general comment, which is the document that has been at the center of Andrea Borgia and Jessica Wyndham's presentation, and then to insist with the Ministry of Foreign Affairs and the Ministry of Health to address health and science-related issues when they send their documents to the United Nations, because in that way we can engage with UN experts in a dialogue and try and make things better and more, in a way, in line with international obligations vis-a-vis international criminal law. And there's, international human rights law. There are other recommendations that are in the draft document that we can share at a later stage. For today, I think we would like to thank all participants. We want to thank the interpreters for the great work and also for their patience. We ran a little longer than expected, and would like to thank the African Parliamentary Forum on Population and Development, Associazione Luca Coscioni, Global Parliamentary Alliance on Health and Development, Science for Democracy, and TAG for their support in this, and all the people that behind the scenes allowed this event to happen. And we won't name names because it's too late. We'll be in touch via email, but feel free to send us questions that we did not have an opportunity to raise today at info@sciencefordemocracy, specifying the person to which the question is addressed. And so I don't know how you clap hands in a webinar, but there are different ways. Let's try and do this. And thank you all. Enjoy the rest of the day or the evening. And we look forward to the next event in which we can continue this discussion and start more comprehensive and concrete collaborations for the advancement of global health through global science. Thank you.
Thank you. Bye-bye.